We're going to use the poll function a lot in this webinar, so please feel free to use the poll function whilst in this webinar. It's completely anonymous, so no one can see your responses. We're going to focus and go through 8 single best answer questions. So question number 1. Let's launch the poll. Mrs. Patel, a 37-year-old woman, visits her GP and is diagnosed with acute otitis media. She has a penicillin allergy and develops a rash when she takes penicillin. She is 25 weeks pregnant. What is the most appropriate treatment for her acute otitis media? Okay, let me share the answers. The majority of you have answered. Okay, so let's go through the answers. The correct answer is D. Let's go through why. So why should we not give this patient amoxicillin? Absolutely, penicillin allergy. So what does that rule out in terms of the penicillin allergy from your options? Absolutely, A and B are ruled out. A, amoxicillin, B, co-amoxiclav, which includes 2 things, amoxicillin and clavulanic acid. What does clavulanic acid do? Just for our own learning. It augments the action of amoxicillin, but it does this in a very smart way. It prevents the breakdown of amoxicillin, absolutely. So it's a beta-lactamase inhibitor. Yes, just as Julia said. Beta-lactamase inhibitor, what that means is beta-lactamases are enzymes that bacteria produce as part of their defense mechanism. So as part of their defense mechanism, they produce these beta-lactamases, which are considered like the mini soldiers that are produced by the bacteria to kill antibiotics. Now, the beauty of clavulanic acid is it's a beta-lactamase inhibitor. It's sort of, we could consider it as holding those soldiers in a headlock to allow amoxicillin to do its thing. So it prevents the beta-lactamases from breaking down the amoxicillin. And therefore, the amoxicillin is free to act against the bacteria. Now, the first 2 are ruled out because of the penicillin allergy. Would we give vancomycin? Why would we? What would we normally use vancomycin for? Yeah, used for a variety of different things. So vancomycin can be used for infective endocarditis. In some cases, can be used for sepsis. It can be used orally for C. difficile. It's the first line for that. Absolutely. There's no indication for it being used for acute otitis media. Now we're down to clarithromycin and erythromycin. So I can see a lot of you have selected erythromycin. What made you select erythromycin? So erythromycin has a much better safety profile when given to pregnant women. And that's why erythromycin is generally the antibiotic that you will see most used for pregnant women. From our options, the most suitable option in pregnancy and the penicillin allergy is erythromycin. Mr. Ivory has been prescribed doxycycline for the treatment of cellulitis. Which of the following is not a side effect of doxycycline? Okay, so the large majority you put down C, which is increased appetite. So that's the correct answer. C is the correct answer. Let's go through why C is the correct answer. So there's a few reasons for this. The first one is in terms of photosensitivity. Tell me more about photosensitivity. What does that mean? Yeah, sensitive to light. Patients can develop a rash. Increased sensitivity to sunlight, patients can develop a rash because of this increased sensitivity to sunlight. What would we advise patients to do when they're on doxycycline? Sunscreen with a high sun protective factor, even if it's a cloudy day, absolutely avoid sunbeds. If you're avoid limit exposure to sunlight is really important. So if you can limit exposure to sunlight, cover up as much of your skin as possible, so less of your skin is exposed to the sun. Nausea is a very common side effect reported by patients taking doxycycline. Quite often, it decreases your appetite rather than increasing your appetite. D, in terms of benign intracranial hypertension, it's a rare but a documented side effect of doxycycline. You want to be mindful if a patient has visual disturbances. You want to counsel patients on, particularly if they develop a severe headache whilst being on the medication, just to get this checked up and ask for a medical opinion. Also, oral disorders as well. So it can cause mouth and throat irritation. So that's another thing that's associated with the use of doxycycline. Next question, Mr. Manchester brings in a dental prescription to your community pharmacy. Which of the following cannot be prescribed by a dental practitioner on a FP10D prescription? Okay, let's share your answers for this. The results from this are always extremely interesting. So it's between vancomycin and temazepam. So we need to look at this rationally. We need to look at what would we expect dentists to prescribe and why. So for those of you that said temazepam should not be prescribed, what is the reason and the indication that a dentist will be using vancomycin for? Anyone? I think it was just a there's a so it's a tough one. So there's actually very pretty much there's no true indication for them to be using vancomycin. And that's why, and particularly most vancomycin indications need intravenous or intramuscular vancomycin. And that's why you're much less likely to see a dentist prescribe this. So vancomycin was actually the incorrect answer. And the reason why I was asking you that question is I was trying to challenge your beliefs as to why it would be used, because a dentist giving you an IV of vancomycin, logically, that should ring alarm bells. But you can only understand that when you truly understand the indications for different medications. Why would they use temazepam? Because a lot of people thought temazepam was incorrect. It's for surgical procedures or for procedures, but what are they trying to manage? Sedation because of anxiety associated with dental procedures. So it's not used, it won't be used all the time. They can use it when someone is severely anxious of a procedure. Mr. Allen, a 25-year-old patient, presents to the accident emergency department with a dog bite. He is assessed and the decision has been made by the medical team to prescribe him antibiotics. He has no medication allergies. Which of the following would be the first-line treatment for a dog bite? It does indeed, Julia. So it does have to go on a CD prescription from the dentist. So I should have clarified that. Okay. While people are answering this, I'm just going to answer another question that I got privately. So in the question like the first one, if a patient has a penicillin allergy, do you assume that the rash is bad and therefore it's a true allergy, or do you challenge the allergy? If you've got that information about the patient's penicillin allergy, you would have to assume that it's a true allergy if it's telling you that in the question. There are some circumstances where the GPhC will ask a question to ask you what is a true allergy when it comes to antibiotics. And what they're trying to ask you in those kind of questions is they're looking at side effects associated with antibiotics, like amoxicillin, for example. And they then they'll give you side effects like nausea or diarrhea associated with amoxicillin, or a rash or shortness of breath. And they'll want you to differentiate between a true allergy and a side effect. So just another point to keep in mind. Let me share the answers for this question. So got a bit of a mix here, but most of you answered B. The correct answer was B. Does anyone know why the correct answer is B? Maybe you've come across the fact that Comox Club is the first line. Do you understand why? Yeah, exactly that, Evelyn. So example of a true allergy is if a patient has difficulty breathing or they have swelling of their throat. An example of side effect would be diarrhea associated with amoxicillin. Essentially good antibiotic cover, but there's something specific. Absolutely odd. It's aerobic and anaerobic cover. And the reason why that's really important is when you have a dog bite, you have to consider the types of bacteria that reside in the mouth of the dog. And it's polymicrobial. It means there's a lot of different bacteria within the mouth. And this specifically could be either aerobic or anaerobic bacteria. So it's very important to cover aerobic organisms. So amoxicillin gives you great cover against aerobic organisms. It gives you some cover against anaerobic organisms, but not as comprehensive in terms of cover as Comoxiclav. So it has a much broader spectrum of activity, and therefore Comoxiclav is often recommended for a dog bite compared to amoxicillin. So there you can see the majority of you have put answer, which is B. Okay, so Mrs. London brings in a prescription for methadone hydrochloride in the 2001 regulations. Drugs are divided into 5 schedules. Which schedule does methadone belong to? Okay, let's share your answers. So everyone has put Schedule 2, which is correct. So methadone belongs to Schedule 2 when we're considering CD classification. In terms of Schedule 2 controlled drugs, this schedule includes substances that have legitimate medicinal uses, but there's also a high potential for it to be abused or for patients to become dependent on these medications. So that's the reason why methadone falls under Schedule 2. Let's move on to the next question. Mrs. Williams is diagnosed with type 1 diabetes mellitus and is commenced on insulin. She's counseled on the side effects of insulin. Which of the following is not a side effect of insulin? Okay, for this, the correct answer was weight loss. So insulin can cause edema. It's a common misconception. What I'm going to do, I'm going to provide you the link of where you can take a look at insulin side effects. So there is a monograph for insulin, all insulins in the BNF. And one of the most common side effects associated with insulin is edema. It can cause lipodystrophy, and it can cause lipodystrophy. It can cause hypoglycemia. So just to go through some of this terminology. So hypoglycemia, of course, is low blood glucose levels. Insulin, as I said in the previous diabetes webinar that we covered, insulin is a key, a hormone that is essentially a key that opens up access to your cells for your glucose that's in your blood. The glucose in your blood can then make its way into the cells. So because all of this glucose in the blood is now being used up, if you give yourself too much insulin, this can lead to low blood glucose levels for type 1 diabetics. And lipodystrophy is localized reactions at the injection site. So it can cause these either lumps or indentations at the injection site associated with insulin use. So particularly when patients are starting insulin, this is when edema, patients can have edema. So they have some level of fluid retention associated with initiating insulin. And there are skin reactions. So in some cases, you can have some redness or irritation or an allergic reaction at the injection site. Weight loss is not typically a side effect associated with insulin. Weight gain can be a side effect associated with insulin use, however. Let's move on to the next question. Mrs. Smith has been prescribed long-term steroids. Which of the following is not a side effect of corticosteroid use? Okay, let's share your answers. So we've got really a split between Addison's disease and muscle wastage. So let's go through all of our different options. So when it comes to diabetes mellitus, long-term corticosteroid use can increase and elevate your blood glucose levels. This can potentially trigger or exacerbate diabetes. So something to keep in mind when patients are on long-term steroids. In terms of osteoporosis, long-term use of steroids can lead to a loss of mineral bone density. This increases the patient's risk of osteoporosis. I can see none of you answered osteoporosis. Weight gain is something that's commonly seen with corticosteroid use. In particular, it can stimulate and increase your appetite. And ultimately, this has a profound impact on your weight. So quite often you will hear patients complain of when they're on long-term steroids of putting on a lot of weight whilst being on steroids. In terms of Addison's disease, what is Addison's disease? So it's because of adrenal insufficiency, not having enough cortisol being produced by the glands. So in particular, you will use corticosteroids. So you'd use steroids to treat Addison's disease. Quite often you would want to use something that's rapid acting, and we'll go through that in our endocrine system session. So you'd quite often use hydrocortisone when it comes to someone in adrenal crisis. So if someone's got such an insufficient level of cortisol that they're going to die. And muscle wastage. So muscle wastage can occur over time, particularly when patients are on long-term steroids. Let's move on to the final question. So the final question is a 56-year-old patient, Andrew Smith, presents to the cardiorespiratory ward with chest pain that occurs on exertion. He is diagnosed with stable angina. Which would be the most suitable treatment option to prevent further episodes of chest pain? So remember, this is prophylaxis of him having another attack of his angina. So for number 7, it was Addison's disease was not a side effect associated with corticosteroid use. Okay, let's share the answers for the last one. So in particular, this was looking at prophylaxis for preventing and managing the stable angina to prevent further episodes of chest pain. So the correct answer would be bisoprolol for preventing for prophylaxis for preventing further episodes of chest pain. GTN spray would be helpful on the onset of that chest pain to essentially manage the symptoms at the time. But in terms of managing the stable angina, the correct answer was bisoprolol. So this is where our session comes to an end. Like I said to you, we've got 2 more places left for the Pro Plus membership and 4 more places left for the Pro Plus Mentor membership. Both of these come with a guarantee. So if you do not pass the June 2024 assessment, you will get your money back. Thank you everyone for attending, and hopefully I'll see you in the next one. Thank you. Hi, Zara. Yes, you can. You'll get sent a PDF document with the mock assessment. So yes, you can.